Vital Signs Part 4. Height and weight principles. So the significance of height and weight. Drug dosage, edema, pregnancy, weight reduction, obesity, eating disorders, and growth. Little cartoon, I keep trying to lose weight, but it keeps finding me. A lot of times you will get patients in the clinic who refuse to be weighed, and we just have to remind them that of the importance of getting weighed each time that they are seen. So height and weight usually is done along with vital signs. However, height and weight is an anthropometric measurement. Adult height and weight is done at the first visit for a baseline, and then usually we will have to do a height every 6 months to a year due to the meaningful use criteria at the clinics. Meaningful use is the appropriate use of our medical records, and there are certain things that we have to collect on each and every patient. And oftentimes in an electronic medical record, they will be highlighted in red, or they will have an alert that it needs to be collected. However, some clinics do not have the electronic capabilities of doing that, so there will be a list of things that need to be collected and need to be checked by the medical assistant. Height and weight is done at every visit for a child, no matter what. The MA must be non-judgmental and maintain a neutral facial expression when taking a patient's height and weight. Privacy of the patient is very important. Scales must be in a private place. They can't be in the waiting room. The MA must put weights back to 0 once it is done. Preparing the scale, clean the height bar with sandy wipes and raise the bar up above the patient's head. Put a clean paper towel on the scale, and then we balance the scale. All weights should be left at the 0, and the weight bar should be free floating and in the center. That means that the scale is balanced. And a lot of times most of our clinics now have electronic scales. However, there are some clinics that are smaller and do have the old-fashioned scales that I am talking about, like pictured in this picture. So we move the lower or the larger weight, seen here, to the appropriate amount. And then once we move it to the appropriate amount, say 50 or 100 or 150, it's always in 50 increments. Then we would move the upper part or the smaller weight until the balance bar is in the middle. Okay. Make sure the weights are in the grooves, and make sure some scales have pounds and kilograms, so make sure you are consistent. If you have your big weight down here in the kilograms, that you're reading me kilograms instead of pounds, okay? If you have it in the pound hash mark, like seen here, then make sure you're reading it to me in pounds. The lower weight bar is divided into 50-pound increments. The upper weight bar is calibrated into pounds and quarter pounds. So your full pound here is your longer hash mark, and then we go to quarter pounds. So quarter, half, 3/4, and then this would be 15 pounds. So here we show a weight of a patient, which would be 120.25 pounds. Here is another weight of a patient, which would be 181. The weight of this patient would be 244.5 pounds. This patient would be 174.5 pounds. So you will want to be familiar with the weight conversions. These will be on your test. To convert pounds to kilograms, you will want to divide the number of pounds by 2.2. To convert kilograms to pounds, you want to multiply the number of kilograms by 2.2. So measuring height. The height bar should be up above the head. Instruct patient to stand straight, and no hair ornaments should be in the hair. Lower onto patient's head. Read at the junction of the stationary or movable bar. It is calibrated in inches and also quarter of inches, and it also will have centimeters on it. So here is what a height bar would look like. That it's just mounted on the wall. However, some scales will have a height bar right on them. So if you look here, this would be 68 inches here, and then each hash mark is a quarter. So this is quarter, and this would be a half. So this patient would be 68.5 inches, or you would say you are 5 foot 8 inches, 8.5 inches. As you can see here, this height bar is right at the 64-inch mark, so we would record that as 64 inches. Or you could tell the patient, oftentimes the patient will be like, well, how tall am I? You would say, well, you are 5 feet 4 inches. Next one, here's the 70-inch mark, quarter and a half, so we got 70.5 inches. So if a patient says, well, how tall is that? You would say you are 5 foot 10.5 inches. So here we have 59 inches. This is the quarter mark, half mark, and then 3/4. So you got 59 3/4 inches. The patient says, well, how tall is that? You would say 5 foot 9 3/4 inches. So height conversions, to convert inches to feet and inches, divide inches by 12. To convert inches to centimeters, multiply the number of inches by 2.54. And to convert centimeters to inches, divide the number of centimeters by 2.54. A good way to calculate these fast is 5 feet is always 60 inches. 6 feet is always 72 inches. And then I plus or minus based off of that. You will also need to calculate BMI. The easiest way for me to calculate BMI, because we usually weigh people in pounds and then convert to kilograms, I like to use pounds. So if a person was 150, and then we usually do height in inches, so you would take what you got in pounds, divide it by height in inches, and then you would divide it again by height in inches. And then once you have that number, you would times it by 703, and you would get your BMI.